An LTACH is a long-term acute care hospital. Generally, it's used to treat people who have long-term medical conditions that require prolonged stays and advanced treatment, meaning specifically they still require acute care just like a normal hospital, but they need more specialized care than that.
To me, an LTACH serves as a step toward home or a step toward rehab or nursing home.
It's just not feasible for a patient to be in the hospital for, 6 months when there's places like the LTACH that can help bridge that gap of care.
I feel that ACCH benefits Northeast Arkansas and the surrounding areas just because we're the only facility like this.
It feels like home. It's a second home until you can go to transition to another.
After you've been in the hospital for a little while and you're still not well, then you need more time. Acute care is not necessarily available through home health or at a rehab center or even in the nursing home. So it requires more acute involvement of nurses and all the infrastructure of a hospital.
The LTACH here is a very important piece of the community, working with the local hospitals to assist them when patients get to the place that they're maybe not sick enough necessarily to stay where they are, but need a place to transition to finish out their care so that hopefully they're able to go home is the goal.
People that may have been kind of cast aside as this patient has not gotten better in the ICU, we just need to kind of push them more towards palliative care or hospice, and instead they have another option now, which is LTACH, and they can come here and we can try a different method. We can try to approach it from a different angle.
I get to see the full circle of care. I get to see them when they're healthy. I see them when they're sick. I help them get better. That's what makes doctors happy. That's really what it's all about.
We offer a level of care that the patients are not going to be able to go find elsewhere.
We are able to provide care that feels like your family is caring for you. Without us, some of the patients would not have got to where they are today to be able to return back to normal.
They were just good to me. We had any questions about anything, we'd ask, and if the nurse didn't know it, she'd find out for us.
We want you to be able to be well enough to go home or to enter rehab and, get stronger and meet your long-term goals.
You've got to have that support or you're not going to make it. The day I left, the nurses lined the hallway and clapped and cheered for me. I mean, that really made me feel proud.
It feels like a family, from the way we treat our patients to the way that staff interacts, from our leadership all the way down.
We are such a team and we're so family oriented.
We want to assemble the best group of professionals that we can provide. We are all in support to each other and we're all patient first and we challenge each other.
Something unique about our staff, a lot of these guys work in ICUs and a lot of our staff work in St. Bernard's Medical Center as well as Baptist that work in our hospital.
I enjoy working here because we serve such a unique need for this community. We can provide that care locally. The hospital's very young and we're growing, and we're proud of what we do and look forward to meeting those in need in the community and serving them and their families.
There have been many, many profound experiences that we've all had where patients came in here and got better, and it was miraculous. And those keep us coming back every day.
If we're not here to take care of the patients, if we don't show that love for the patients and love for each other, I'm not quite sure what we're doing in healthcare in the first place.
We have a very dedicated, competent staff here of physicians, physical therapists, occupational therapists, speech therapists, nurses, and respiratory therapists that all have training in the ICU setting.
We're here to take care of the patients and make sure we've got the resources that Jonesboro and this entire region needs. From a health catchment, that's basically about 600,000 lives.
For a long time, this community has never had this option of care in the northeast region of Arkansas.
If I have a concern or if I have a need, it doesn't just fall on deaf ears. Everybody in the building can hear because everybody in the building is involved.
People traveling from other cities to our LTACH, it's a great compliment to have those patients come here, and they want to come here because of the quality of care and the level of service that can be offered to them here.
We have the time to be able to bond with our patients and really get to know them on an individual level. It's really nice to get that satisfaction that what we're doing is making a difference in someone's life.
That's why we all get in this, right? I mean, it's meaningful work, right? And that's what I love about the team here. They come to work every day with the patient as a central driver, the focal point of everything they do.
The majority of the patients that we get are patients that are in dire need of our assistance. Their families are exhausted, the patients are exhausted.
Every day is not going to be a good day. They're not going to feel great every day. So when they have those days, it's imperative for us as the care team to say, I know you're having a bad day, but we're going to have tomorrow. I'm here with you to help you get to tomorrow.
We institute our protocols and use our experience, and they improve, and you start to see their hope return, their will to live return, to take a patient who in some cases no one thinks will ever get better, and then give them their life back. That's something very, very special to be a part of.